Let's move on to the next one. This is a story I've been really wanting to cover and spend some time on. Absolutely tragic. Deaths of despair skyrocketing here in the United States. We're going to start off one where you can either be glass half full or glass half empty. Let's go ahead and put this up there. I'm going to choose empty just because of the sheer scale of what's happening. This is about new CDC life expectancy data, which shows a rebound from 2020. Now, at a glance, you might think that that's good. A decline in U.S. life expectancy from coronavirus eased in 2022, and that was the majority of the headlines that was released, including by the CDC. What they fail to mention is that the country remains, quote, well behind the overall peak of life expectancy in 2014. But even more importantly, Krystal, I went through and I reviewed the data. Our life expectancy data is now on par with 2001. So let that sink in. We have had a 20-year setback now, and we continue on a decline of life expectancy. 2020 and 2021 obviously were extraordinary. They had the biggest drop in life expectancy not seen since World War I here in the US. Some of that was attributable to COVID. But if you read and you actually get into the data, there are two glaring reasons why life expectancy has been on a general decline since 2014. It is chronic illness, drug overdose, and suicide. Chronic illness being one of the #1 killers here in the United States. Drug overdose already surpassing car accidents and others, one of the #1 cause of death for people who are young. And then the suicide rate also going sky high. And to that end, we actually have the suicide data, which is really, truly heartbreaking whenever you break it down. U.S. suicides per 100,000 actually went up to the highest per capita rate since 1941. The actual number of suicides has hit a record high. So there are two important parts of that. The record high number is obviously just devastating. You know, you're losing nearly 50,000 people in the United States to suicide just in 2022. But I actually thought that per capita number was most important. And a lot of people might be asking, what the hell was happening in 1941? I went back and I pulled the suicide data. Krystal, unfortunately, it was the tail end effects of the Great Depression. Suicides actually peaked here in the United States in 1937 per capita. Absolute untold numbers of people per capita were killing themselves at that time simply because they couldn't feed their families from despair and more. And we are seeing a recreation of that. The tail end now effective 1941 for the per capita rate on suicide. Chronic illness, drug overdose, the deaths of despair has peaked now at 2022. That's 8 years now into the decline. I mean, and this to me is the most important story in the US. And something Andrew Yang, to his credit, always used to talk about during his 2020 run. I always loved whenever he brought that up. It's the most basic metric of how a society is doing. Are people living or dying?
In terms of the suicide numbers, what jumps out here is, there'd been a really alarming increase in young people committing suicide, and whatever interventions have been taken. I think also just, teenagers being back in school and having their social networks back intact has probably been useful there as well. Those numbers have actually gone down. So that's encouraging. So that tells you that there are things we could do about it. On the other side, what is absolutely heart-wrenching is older people, and especially old men, are killing themselves at rates that we have just almost never seen before. And it's horrific and heartbreaking to think about what leads you to that place. Is it financial stress? Is it health stress? Is it feeling that you're a burden on people? Is it our broken elder care system where there are no good solutions for our elders, in the latter years of their life? And you're right, Saagar. I mean, this is a horrifying indictment of our entire society, both on the suicide rate and also on life expectancy. If you dig into some of those numbers on life expectancy, there were a few things that I wanted to point out. First of all, they have it broken down by racial category, and the decline among American Indians or Native Americans over this period, you can't even wrap your head around it. They suffered a loss of almost 4 years in life expectancy to 68 years. Black people suffered the second largest life expectancy setback of 2 years. Hispanics suffered an almost 2-year life expectancy drop. And these numbers are just, unconscionable. Now, COVID, of course, played a huge role in this story. There was no other wealthy country that experienced so high a rate of death per capita from COVID as ours. But that is not disconnected from the other issues that they point out here, including the chronic health conditions, which are really underappreciated as one of the major reasons that we've seen this fall in life expectancy. To put it plainly, our healthcare system is total shit. It's dramatically expensive. You still have so many people who are either uninsured or underinsured, who can't go to the doctor when they're sick. Then you have, on top of that, the subsidization of like the worst type of foods, and like the type of poison that we're just pumping into our people day in and day out. We have these incredibly sedentary lifestyles. And you add this all in and you just see a calamity in terms of our basic health and in terms of our life expectancy. So even with, COVID, it's certainly not gone, but, more or less in the rearview mirror, you can see the effects of these long-term trends in decline in our basic health persisting. We're also the only, wealthy nation that doesn't have some sort of universal healthcare system. And I think that is a huge part of the story as well, which, by the way, doesn't get a mention in the Washington Post article.
Healthcare is a huge part of the story. Chronic illness is number one. By state, this also is just so obvious whenever it bears out. The lowest life expectancy in the U.S., the state of Mississippi, unexpectedly also has the highest obesity rate and also a very high poverty rate. Number two, West Virginia, same thing. You've got tons of obesity. You've got a huge drug problem. You have an immense amount of poverty. Number three was Louisiana, then Alabama, Kentucky, Tennessee, Arkansas, Oklahoma, New Mexico, South Carolina. All of the things that jump out from there is that if you have lack of access to healthcare, you have poverty, you have chronic illness, and you have extraordinarily high rates of obesity. And that's what you also brought up. One of the reasons the U.S. suffered more than any other developed country on the world is because we're the fattest developed country on earth. And, this is one of those where you have underlying health conditions, you're extraordinarily unhealthy, you have a lack of access to healthcare, and it's much easier for a relatively minor, illness like COVID to push somebody who is hanging on by a thread. Drug overdose is also a massive part of this, and I don't want to move past it as well, because drug overdoses, fentanyl overdose specifically, accounted for tens of thousands of deaths in the United States just last year in 2022. The official numbers, not yet clear, but it does come through in the life expectancy number. So while it's good that we've made strides and we've slightly reduced the suicide rate for young people, the elder one there, we shouldn't move past as well, because it actually was especially highest, and this is not surprising, amongst older men over the age of 75 who were either suffering from loneliness or a health condition. And the thing is, too, is this is a North American phenomenon. I don't know if anybody's tracking. There's a big debate right now in Canada over assisted suicide, and whether it should be legal or not. I have complicated feelings about the matter, and that's probably a subject for another day. What is not deniable is that huge numbers of Canadians are taking advantage of this. And anytime people are taking advantage of a program to voluntarily end their life through the state, whether you think that should be allowed or not, that is extraordinarily grim. So I think some of this is downstream from metaphysical, I guess for lack of a better word, conditions, but a lot of it is a crisis internally and of structure of the U.S. But I don't know, I can't help but look at that. You got the highest suicide rate since World War II and the Great Depression. And this floated into the ether. I actually don't know a single major news outlet that talked about it in a cable format or in a discussion format like what we're doing here. I looked actually.
Yeah. Well, and it ties into, not that everything's about politics, but all this debate online of like, oh, why are people saying things aren't going well? Why aren't they happy with the Joe Biden economy? And then you look at these metrics of just like the most basic measure of well-being, and it's a catastrophe. So, how can you look at those numbers and then, imagine that people are going to think that things are going well and we're on the right track and the society's on the up and up.
Hey guys, if you like that video, go to breakingpoints.com, become a premium subscriber, and help us build the best independent media organization on the planet.
That's right. We're subscriber funded. We're building something new. We want to replace these failing mainstream media organizations.
So again, to subscribe, it's breakingpoints.com.